Ian Bain has always been active. He was a CFL referee for years, even after he was diagnosed with type 2 diabetes. He keeps his disease under good control with careful monitoring and insulin. Nonetheless, diabetes has damaged his nerves, especially in his feet.
I broke my foot in 4 places, and I didn't realize it at the time, and I was actually a referee in a football game.
Diabetic peripheral neuropathy means there's damage to the nerves that allow you to feel pain. So Bain constantly checks his feet for injuries, blisters, or ulcers that he doesn't feel.
Sometimes when I've had an ulcer, I didn't know I had one until I saw traces of blood on the floor.
A lot of the time when we're consulted to see these wounds in these patients, we come in far too late.
It doesn't measure actual values.
Dr. Brianne Everett says if patients leave it too long, they could face surgery, even amputation, which is why she was motivated to design a medical device that people with diabetes can use as an early warning system.
So it's an insole that fits into a normal shoe just like any other insole would, and it contains a pressure sensing mat within that insole. So that mat takes pressure data, and then that's fed to a little node that clips to the shoelaces.
The sensor transmits the information to a wristwatch, alerting a patient if they're putting too much pressure on one part of their foot and potentially cutting off blood supply and then damaging the foot. For people with virtually no sensation, she's creating a sensor that would transmit information to a pad on the patient's back.
You feel your feet through your back.
This is interesting. Okay, Karen joins us now. So tell us more about this, about feeling your feet through your back. How does that work?
It's such a hard concept to wrap your head around. But basically, it's your brain processing your senses, right? So they're getting the signals from your feet, unless they're damaged. And then you can send those signals to some other part of your body, like your back, and your brain still gets the message.
Wow. Okay, so this kind of reminds me of the story you did a little while ago about Jose Neto, who was blind, and he was able to, through a sensor, send signals to his tongue to see.
Yes, that's exactly what it is. It's the same thing. It's called neuroplasticity. And the reason they chose the back in this case is it's not usually affected by neuropathy. Plus, it's quite a big area, right? So you can put the sensors in there, hide it underneath. But they could have put this anywhere. And of course, this is all in trial still. It's not on the market quite yet.
Fascinating. Okay, Karen, thank you.
You're welcome.